You know that one nagging, persistent knot in your shoulder or your back? Yeah, the one that just refuses to go away no matter what you do? Well, it turns out there's a clinical name for it: myofascial pain syndrome. It's one of the most common reasons for chronic muscle pain on the entire planet, but it's also one of the most misunderstood. So today, we're going to unravel the hidden story of those muscle knots. Just let this number sink in for a second. More than 75% of people worldwide will experience what's called myofascial pain syndrome, or MPS, at some point in their life. This is not some rare, obscure condition. It's pretty much a fundamental part of the human experience with pain. So, if it's really that common, could it be the real culprit behind your nagging pain? Let's dive into the science of those muscle knots and find out what's really happening just under the skin. Okay, first, let's just try to grasp the sheer scale of this invisible epidemic and see who really bears the brunt of it. Wow. Okay, just look at this breakdown. Among middle-aged adults, it hits 37% of men, which, is already a huge number. But for women, that number just skyrockets to 65%. That is a massive difference, and it tells us something really important about who is being affected the most. And make no mistake, this goes way beyond just feeling a little sore. MPS is actually a leading cause of people being unable to work, and it has a profound, deep impact on mental health. The connection to depression, anxiety, and stress is absolutely undeniable. So what's actually causing all this trouble? Well, to understand that, we need to zoom in on the real culprit, a tiny but incredibly powerful source of pain called a trigger point. So, a myofascial trigger point, or MTRP for short, is basically a tiny, angry knot. Just imagine a microcramp that's locked deep inside a tight band of muscle. But what's really wild is that it doesn't just hurt right there. It can shoot pain to a completely different part of your body. That's what we call referred pain. Finding these things is real detective work, and it's all done by feel. A clinician will carefully press along the muscle, almost like they're searching for this little rope-like band. And when they find it and press on just the right spot, oh yeah, you'll know. It's that very specific, intense tenderness that confirms they've hit the trigger point. But how does a tiny spot like that even form in the first place? Well, the answer isn't in the whole muscle, but deep inside the individual cells. And there's this fascinating theory that explains it all. It's called the dysfunctional energy crisis theory, which sounds pretty dramatic because, well, for your muscle cells, it is. The theory basically says that the trigger point is a tiny patch of muscle that has suffered a complete and total power failure. Okay, let's trace this chain reaction. It all starts with some kind of stress on the muscle. This causes a flood of calcium, which locks the muscle fibers in a contracted state. And you see how that contraction then squeezes the blood vessels? Well, that cuts off fuel and oxygen. Without that fuel, the cells can't produce energy, what's known as ATP. The result is a tiny localized energy blackout, a buildup of metabolic waste, and boom, the birth of a painful trigger point. And right here, this is what that crisis looks like under a microscope. On the bottom, you've got this nice, healthy, organized muscle tissue. But look at the top. That's from a trigger point. The fibers are all swollen, chaotic, and just permanently contracted. You are literally seeing that energy crisis in action. Since there isn't one single blood test or scan that can definitively say, yep, you have MPS, diagnosing it is a lot like putting together the pieces of a puzzle. Clinicians have to look for a very specific set of clues. So, here are the key clues a clinician is hunting for. First, they have to find that taut, ropey band in the muscle. Then, they pinpoint that one incredibly tender spot. But the real confirmation? Pressing on it reproduces the exact pain you've been feeling. Sometimes you'll even see the muscle itself twitch in response. That's called a local twitch response. For decades, this diagnosis was all based on touch. But now, technology is giving us a whole new window. What you're looking at here is an ultrasound image. And those highlighted areas, those are the trigger points in the shoulder muscles. For the very first time, we can get objective, visual proof of what was once totally invisible. All right, now for the part everyone wants to know about. What can we actually do about it? The good news is that there's a wide and growing toolkit of treatments available. Let's take a look at the options.
So, a cornerstone of treatment is hands-on physical therapy. We're talking techniques like deep pressure, myofascial release, and really targeted stretching. They're all designed to physically break up that knot, release the tension, and get blood flowing freely back to the area to resolve that energy crisis we talked about. Needling is another really common approach, but there are two main types. Dry needling uses a thin, solid needle to go in and mechanically break up the trigger point. That's often what causes that little twitch. Wet needling is different. It uses a hollow needle to inject something, like a local anesthetic to calm the nerve down or a steroid to fight inflammation. But here's the thing. Treatment can't just focus on the muscle alone. This statistic is absolutely staggering. Up to 85% of chronic pain patients also have severe depression. It's just a powerful reminder that the mind and body are inseparable, and any real solution has to treat both. And this is where a more holistic approach becomes so critical. Things like exercise, yoga, and meditation aren't just for relaxation. They directly address the psychological side of pain. They help manage the stress that we now know can create those trigger points in the first place. So where is all of this headed? Well, the field of pain management is evolving incredibly quickly. Let's take a quick peek at the innovations on the horizon that are shaping the future of relief. The future here is really exciting. We're seeing things like platelet-rich plasma, or PRP, which uses your own body's growth factors to heal the tissue. That ultrasound we saw earlier is now used to guide injections with pinpoint accuracy. And pretty soon, wearable tech and even AI will help create treatment plans that are perfectly tailored to your body. So, what's the ultimate takeaway from all this? It's that there is no single magic bullet. The absolute best approach is a personalized one, combining those proven hands-on therapies with these amazing new innovations to create a strategy that can finally bring some relief. Which leaves us with a really powerful question. For so long, this pain has been invisible, diagnosed only by feel. But now, science is giving us the tools to finally see it, to understand it, and to treat it precisely. Just think, what could that mean for the quality of life for the millions of people living with it? It means the future of pain management is finally and clearly coming into focus.